Good morning, everyone. Okay, so today we'll be discussing about one of the most important topic, that is coronary arteries. Okay, so if you have seen the previous year questions, the applied aspect plus gross anatomy of coronary arteries are very important. Many times it has been asked. Okay, so first we'll discuss the coronary arteries. What are exactly these coronary arteries? Okay, from where they are coming, what are the importance of these coronary arteries, what are some peculiarities of the coronary arteries, okay, followed by the applied importance. Now, in this diagram, you can see the coronary arteries. First of all, you can see the diagram of heart. Okay, if you focus these two diagrams, what you can see over here, these are the diagrams of heart showing from both aspect. Okay, this is from the anterior aspect, this is from the posterior aspect. Now please keep that in mind whenever you are writing in the exam or you are studying about the coronary arteries, you have to consider these two views, okay, anterior view as well as posterior view of the heart. Okay, why? Because the arteries and the branching pattern or the distribution of the arteries are not present in the anterior aspect, but they are also on the posterior aspect. Okay, so please keep that in mind once you are drawing the diagram to show the coronary arteries. Okay, you have to draw two diagrams, okay, one for the anterior view, another for the posterior view. So today I will be showing some interesting diagrams, and along with that I will show you some easy diagrams which can be drawn during the time of exam. Okay, now in your books I hope you have seen so many 3D diagrams are there, but those diagrams are not possible to draw during the time of exam. Okay, so today I will show you some easy schematic diagram which you can draw during the time of exam. It will be easier for you. Okay, now what is the coronary arteries? So coronary circulation refers to the blood vessels which supply and drains the heart. Okay, now you know that heart is pumping blood to the various part of the body, right? We know that heart is pumping blood to the various part of the body, but the heart itself needs blood. Okay, why the heart itself needs blood? We know that our heart is pumping blood to the various part of our body. Now the question is, why the heart itself it requires blood? Yes, very good. It's a muscular organ. Then, now before going to that, do you know what are the layers of the walls of heart? Now let me show you the diagram. Now in this diagram you can see the wall of the heart. Now in that mainly three layers are there. First layer is the endocardium. As you can see, this is the endocardium. Then this is the myocardium, and this is the epicardium or pericardium. Okay, where a visceral layer is there, and then the parietal layer is there, and in between them a small gap is also present. Okay, so these things already you have studied, right? Now if you see the thickness of the wall, among them only 75 to 100 micrometer of the endothelial surface, means this particular part is getting blood directly from the chambers of the heart. What about the remaining part? So this entire remaining part is depending on these coronary arteries. Okay, that's why the heart requires additional blood supply in the form of coronary arteries, which supplies blood to the various part of the heart. Okay, because if you see the thickness, now in these particular areas the muscle fibers are there, they also require blood supply. Without that they can't function. So from where they will get the blood? Okay, so those blood is supplied to that area with the help of these coronary arteries. Okay, so that is the importance of the coronary artery. Now as you know that, now the question is, why these are called as coronary arteries? Because if you see the coronary arteries, mainly two coronary arteries are there, one on the right side and one on the left side. And these coronary arteries along with the branches, they encircle the heart just like a crown. ओके, जो कोरोनरी आर्टरीज का ब्रांचेस है राइट साइड एंड लेफ्ट साइड, दे एनसर्कल द हार्ट जस्ट लाइक ए क्राउन. दैट्स व्हाई इट इज कॉल्ड एज कोरोनरी आर्टरी. ओके, Now, as I have mentioned that there are two coronary arteries, right and left coronary artery. Okay. Now the question is from where they are arising. कोई भी artery है तो उसका एक origin point रहेगा. That from this particular point it is arising, right? Now, can anyone tell me which is the origin of these coronary arteries? So as I have mentioned, two coronary arteries are there, and in this diagram also you have seen. So see, this is the right coronary artery and this is the left coronary artery with its branches, right? Now the question is, जो दो coronary artery ऐसे निकल के आता है, now what is the point of origin? Now this is very interesting, okay? And along with that some peculiarities are there associated with the origin. Now, if you have studied the ascending aorta, I don't know whether you have studied or not, the aorta which is there, I am talking about the thoracic aorta, okay, it is having three parts. Okay, so when it is arising, this is called as ascending aorta, then the arch of the aorta, and then the descending aorta. I hope in the dissection also you have seen, right? Now, when it is arising, can anyone tell me from which chamber it is arising? Okay, can anyone tell me from where the aorta is coming out, from which chamber? Left ventricle. Okay, from left ventricle. Now, when the aorta is arising from the left ventricle, okay, the aortic opening is there. Now this aortic opening is guarded by a valve that is called as aortic valve, okay, that is a type of semilunar valve. Now just distal to the valve, okay, there are dilatations, or also called as sinuses, aortic sinuses. Three aortic sinuses are there. Among them, from those two aortic sinuses, the coronary arteries are arising. Okay, right and left coronary arteries, those are arising from those aortic sinuses. Okay, so that is the point of origin. Now, aortic sinuses are small openings found in the aorta behind the right flaps of the aorta, right and left flaps of the aortic valve. Okay, from there only this artery used to arise. Okay, so this is a very important point. Whenever you are writing about the coronary arteries, any of the coronary artery, you have to mention from where it is arising. Okay. Now, when the heart is relaxed, okay, the backflow of the blood fills these pockets, and from there blood goes inside the coronary arteries. Okay. Now, what does it mean? When the heart is relaxed, when the heart is not contracted. Now, this is the speciality. In other arteries or other vessels, how the blood enters, when the heart will contract, at that time blood will enter. But यहाँ पे उल्टा होता है. When the heart is relaxed, at that time some backflow is there. Okay. Now the backflow is not going inside the heart because the aortic valves are there. Now when the backflow is there, those pockets or those sinuses used to fill by the blood, and from there that blood is entering into the coronary arteries. Okay. So these are some peculiarities of the coronary arteries. Next, here you can see the origins of the coronary artery. So this is the cut section of the ascending aorta. Okay. Here you can see this is the aortic valve, okay, which is semilunar shaped. So three cusps are there. Now, along with the three cusps, you can see some dilatations are there in this side also, this side also. Actually, three dilatations are there. So this is the right dilatation, this is the left dilatation, or also called as right coronary sinus, left coronary sinus, and this is NCC, means non-coronary sinus. Okay. So from here also one sinus is present, but from this particular sinus no coronary artery arises. So from this particular areas you can see the coronary artery arises. Okay. So why the TS is taken? Because if the artery is continue, you can't see the origin. That's why the TS is taken, so that you can see the sinuses and the origin of the both the arteries, right and left coronary artery. Okay. So this is the origin. Now, features of the coronary arteries. Now this is very important. You must know some important features, or also in some books it is written as peculiarities of the coronary arteries. There are some peculiarities. Now what are these peculiarities? First of all, blood flows through these arteries during the diastole. That means whenever the heart is relaxed, at that time the blood is entering these arteries. This is one important feature. then the left coronary artery is larger in caliber and supplies more of the myocardium as compared to the right coronary artery. Okay. Next, these arteries are functional end arteries. Now, what is the meaning of this? What is the meaning of functional end artery? Any idea? Now, what are the meaning of end arteries? Actually, coronary arteries are not end artery, but they behave as they are end arteries. Now, the question is, what is the meaning of end artery? END, end. So what is the meaning of end artery? Any idea? Several times we have discussed this inside the classroom. What is the concept of this end artery? See, in most of the cases what happens, collateral circulation exists. Okay, that means blood vessel is coming from either side. Okay, and then the collateral circulation is taking place in the form of anastomosis to supply a particular area. Okay. Now, if suppose one particular blood vessel is coming and supplying that area, okay, and no other blood vessels are present in that particular area to supply it, then that is called as end artery. Means the artery will come, it will distribute, it will give branches to this particular area, khatam. That is called end artery. Now, suppose one artery is coming from one side, another artery is coming from another side, those are giving branches. And then if the anastomosis is taking place, then it is called as collateral circulation. ठीक है, तो blood दोनों साइड से आ रहा है, तो एक साइड से ब्लॉक हुआ तो दूसरा साइड से blood will go and supply area. ठीक है, that is called collateral circulation. Now in heart what happens? Actually the functionally it is not end artery. Why? Because we will see that जो right coronary artery है and left coronary artery, जब branch they anastomose with each other. But the anastomotic channel takes time to open. That's why it is called as functional end arteries. Is it clear? Next, the origin of the posterior interventricular artery, very important branch, okay, which decide the dominance of the artery. Now, in your heart or in any individual, दो coronary artery होता है, among them one is the dominant one. Now how we will find out which is the dominant one? Either right dominant or left dominant. How we will find? Okay, and in some cases co-dominant is also there. ठीक है? But in majority of the cases right dominant is present. That means right coronary artery is dominant. Now how we will decide that right one is dominant or left one is dominant? That is based on this posterior interventricular artery. Okay? Now this posterior interventricular artery determines the dominance of the artery. Now in most of the cases, approximately 80% of the 80 to 85% of the cases it is right dominant. Okay? Remaining it is left dominant. And another important point which we will discuss in applied part, that is these particular coronary arteries, they are prone to develop atherosclerosis or atherosclerotic plaque formation is very common in case of the coronary arteries, which causes the partial obstruction or complete obstruction of the coronary artery. Okay, that we will discuss in the applied part. Okay? Now let's start with the coronary artery, particular one, that is first we will discuss about the right coronary artery, okay, and then the left coronary artery. Now here I have marked some points, I have given some points. If you can see, now why I have given these points? See, whenever the question comes from coronary artery, okay, I am talking about coronary arteries, okay, either it will come from right coronary artery or left coronary artery. दोनों एक साथ नहीं आता है, कोई भी एक आएगा. ठीक है, so you have to write about any one. So how to start? Okay, what are the points you have to write? How you will describe the artery? So see, several times I have mentioned that don't write in paragraph 2-3 pages. Doesn't make any sense. You have to be very specific and you have to write point wise. Okay? So these are the points which you have to mention whenever you are writing about any of the artery, either right coronary artery or left coronary artery. Okay? So what are the points? First is the origin. So origin already I have shown you in the diagram. So you know the origin. Now once the artery arises, next will be the course of the artery, as you can see in the diagram. So two color codes are given so that you can differentiate, okay, between the right and left coronary artery. So you can see the origin, and then this is the course of the artery. Okay, this is the course. Next, in the course we are getting segments. In case of right coronary artery, 3 segments are there. Okay, proximal segment, mid segment and distal segments. Okay, 3 segments रहता है. And then the termination, okay, where it is terminating. After that, the branches. So here you can see so many branches are coming out from the right coronary artery. And after that, the area of supply. Okay, that means which areas of the heart, okay, which areas of the heart are supplied by the right coronary artery. These are the points that must be there whenever you are writing about any of the coronary arteries. Is it clear? Don't just write every starting, it arises, then it goes here, then it giving branches. Okay, don't mix everything together. Write it separately. Okay. So we'll try to understand the origin. So as I have mentioned, it arises from the right aortic sinus. Okay, it arises from the right aortic sinus of the ascending aorta. Okay. As you can see over here. Now can anyone tell me where is the aorta in this diagram? Where is the aorta? Tell me. Okay, very good. Yes, this side, last bench. Can you see the aorta? No, the last bench. Last. Can you see the aorta? Okay. So here you can see this is the ascending aorta. Okay, this is the arch of the aorta, and then here you will be getting the descending aorta. Okay, these are the 3 parts of the thoracic aorta. Now, as I have mentioned, from the right aortic sinus, this particular right coronary artery is arising. Okay. Now once it arises, what will happen? Once it arises, that means origin. After that, course. See, after that the course, and then we'll discuss the segments. Now if you see the course, first it passes forward and to right. Okay. After origin, it will go forward and on the right side to emerge on the surface of the heart, so that you can see the right coronary artery. Okay. Next, when it is emerging on the surface of the heart, at that time it is situated in between the pulmonary trunk and the right auricle. As you can see, this is the pulmonary trunk and this is the right auricle. यहाँ पे ऐसा right auricle रहेगा. So here you will be getting the right coronary artery. Then it runs downwards in the right coronary sulcus. After that you can see it is going downwards into the right coronary sulcus. Okay. Now at the junction of the right and the inferior border of the heart, so you can see it is extending downwards into the right coronary sulcus up to the right border and inferior border of the heart. Okay. After that, what will happen? It will wind around the inferior border and then it will go into the diaphragmatic surface of the heart. Okay. As you can see, it is coming, it is winding around the inferior border and then it is going posteriorly. Can you see? It is going as a posteriorly. So that is also the course. Now for that, what you have to do? तो यहाँ तक तो interior view में दिखाई दे रहा है. After that, what you will do? You have to see the posterior view. ठीक है? Now for example, suppose this is the artery which is present over here. Okay, this is the artery which is present over here. Now this is the interior view. Now from here, it is going into the posterior aspect. Like this, it is going into the posterior aspect. What you have to do to see the posterior aspect? You have to turn it like this. Once you turn it, now you are looking at the posterior view of the heart. Okay? So see, I will turn it. See, I have turned it. Now you can see the posterior view. So can you see the right coronary artery? ये देखो, घूम के यहाँ से पीछे आ रहा है. ठीक है? So that's why I mentioned you have to use 2 different diagrams to understand the course, entire course and the termination. So it winds around the inferior border to reach the diaphragmatic surface of the heart. So this is the diaphragmatic surface of the heart, as you can see. Now here it turns backward and to left. Okay, in the right posterior coronary sulcus. Okay, it will go towards the left side in the right posterior coronary sulcus. Now once it reaches the posterior coronary sulcus, okay, it will go to the posterior interventricular groove. If you have not studied the sulci and groove of the heart, it will be difficult for you to understand. Because in the previous classes I mentioned that on the surfaces of the heart, both the view, anterior as well as posterior, different grooves or sulci are present. And through those grooves and sulci, these coronary arteries, branches of the coronary arteries, veins of the heart, okay, nerves of the heart, they are passing. So you must know the name of the grooves and where they are present exactly. Okay. Now once it winds around the inferior border, it reaches the diaphragmatic surface, then it runs backwards and to the left in the right posterior coronary sulcus to reach the posterior interventricular groove. Now once it reaches the posterior interventricular groove, what will happen? It will anastomose, okay, it terminates by anastomosing with the circumflex branch of the left coronary artery. So here you can see the circumflex branch of the left coronary artery. So this is the right coronary artery. So it will anastomose and it will terminate over here. Okay. Now this point of the termination is slightly left to the crux of the heart. Anyone have you heard what is the crux of the heart? I know you have not heard. Why? Because you have not studied the grooves and sulci. Grooves or sulci of the heart. If you have studied, you should have known what is the crux of the heart. Okay? So in the posterior interventricular groove on the left side, see this is the circumflex branch, which is a branch of left coronary artery, okay, and this is the right coronary artery. They anastomose and it terminates, and the point of termination is on the left side of the crux of the heart. Okay, now crux of the heart is a meeting point of interatrial, atrioventricular and posterior interventricular groove. Okay, interatrial, atrioventricular and posterior interventricular groove. Okay, where these grooves meet, the meeting point is called as crux of the heart. Okay. So this is the termination. Next is the segments. Okay, so three segments are there. Proximal segment, as you can see, this is the proximal segment, this is the middle segment, and this is the distal segments. Okay. Now why these segments are given? So that you can understand the branches, because from each and every segment different branches are arising. That's why the segments are given. Okay. Next is the branches. Okay. Next is the branches. So in order to understand the branches, two things are there. Either you can use this chart. Okay, I have taken this chart from BDC. So everyone, you are having BDC, you can use this chart, but don't forget to draw the diagram. If you are using this chart also, you have to draw the diagram. Now in this particular chart, you can see the right coronary artery and you can see all the branches given. Okay. Now numerous branches are there. Now the best way to study these branches are divided into atrial rami and ventricular rami, or also called as atrial branches and ventricular branches. Okay? जितना भी branch है, what you have to do? We have to segregate them into atrial rami and ventricular rami, or also called as atrial branches and ventricular branches. Kindly note that point. After that, you have to list all the atrial branches and where they are going, and then ventricular branches where they are going. That's it. This is the easiest way you can write about the branches of the right coronary artery. Not only right coronary artery, in case of left also, the technique will remain same. Okay? The previous diagram which I have shown you, and the diagram which you can see right now, which one is the easiest one? This one. Okay? So as I have mentioned, that I got some easy diagram which you can draw during the time of exam. Okay? Now this is the diagram showing the coronary arteries, both right and left coronary arteries. Okay? Now what you can see exactly in this diagram, you can see the origin. ये देखो aorta से origin हो रहा है. You can see the course, you can see the branches, and you can see the termination also. Okay? So this is one of the easiest diagram to draw for this particular coronary arteries. So two diagrams are there which I will show you today. Okay? Now it's my suggestion that you can use this diagram during the time of exam. Rest, it's up to you. If you want to draw, you can draw. If you want to draw different diagram, it's up to you. No problem. Okay? Now, as I have mentioned, what you have to do first for the branches. So we have seen the course, right? We have seen the origin, we have seen the course, and we have seen the termination. ये देखो ऐसे जाके यहाँ पे terminate हो रहा है. Okay, see, this is the termination. Now, once the termination is done, for the termination, please don't depend on the anterior view. You have to see the posterior view also, right? ये देखो. So this is also easy diagram showing the posterior view. तो ये देखो posterior. This is the termination. So here you can see the right coronary artery. The anastomosis is taking place with the circumflex branch of the left coronary artery. This is the termination, and this is the crux of the heart. Okay. So on the left side of the crux of the heart, the termination is taking place. So like this, these two diagrams you can use. Now the question is, what about the branches? Now see the branches one by one. First is the ventricular rami. Okay, first we will see the ventricular rami of the right coronary artery. Now usually the first branch of the right coronary artery is the right conus artery. The first branch of the right coronary artery is the right conus artery. Can you see the right conus artery? This is the right conus artery. Okay. Now there are some cases where this right conus artery, it arises from the aortic sinuses. There are some cases. In that case, this right conus artery is called as third coronary artery. We know that two coronary arteries are there, right and left. Okay. Now in some cases it is found that ये जो right conus artery है, it arises from the aortic sinus. In that case, the right conus artery is called as third coronary artery. Okay. Now, don't write that three coronary arteries are there. I have given you the situation that when it is called as third coronary artery. Okay. Now this right conus artery is mainly supplying the infundibulum of the right ventricle. Okay, तो यहाँ पे right ventricle रहता है, तो infundibulum of the right ventricle is supplied by the right conus artery. Okay, now the right conus artery sometimes anastomosis with the left conus artery. As you can see, this is the right conus artery. Some anastomosis with the left conus artery, mainly arising from the circumflex branch. In this case, this anastomosis which is taking place, okay, is called as annulus of Vuissens. ये जो anastomosis हो रहा है, that is called as annulus of Vuissens. ठीक है? And this anastomosis is taking place in front of the infundibulum of right ventricle. ठीक है? Next, right anterior ventricular rami. तो ये हो गया right conus artery. Then right anterior ventricular rami, 3 to 4 in number. Okay, which mainly supplies the sternocostal surface of the right ventricle. Now, among them, one ventricular rami is longer, very long, and that is called as right marginal artery, which follows the inferior border and extend up to the apex of the heart and supplies the adjoining areas. Okay, that is the right marginal artery. So these are the ventricular rami, or also called as ventricular branches. Next are the atrial rami, or also called as atrial branches. Now, in some books I have seen what they have done. They have divided the atrial rami or atrial branches into 3 different groups. For example, anterior, lateral and posterior groups. Okay? Now, which supplies the myocardium of the right atrium. Okay? Now, from the atrial rami, as you can see, these are the atrial rami. These are the atrial rami. This one. Okay? Now, one of the important branch which is coming out, that is called as SA Nodal artery. Okay, SA Nodal artery. ये देखो, this is the SA Nodal artery, which is supplying the SA node. Now, in 65% cases of the population, this SA Nodal artery is coming out from the right coronary artery, and in 35% of the cases, it is coming from left coronary artery. Okay, so most of the cases you will see SA nodal artery, okay, is coming out from right coronary artery, and SA nodal artery is a type of atrial rami, okay, atrial branches. Next, right posterior ventricular rami is also there. Okay, now this posterior ventricular rami, few branches arising from the trunk of the right coronary artery in the posterior part of the atrioventricular group, which supplies the diaphragmatic surface. Okay. Next is the posterior interventricular branch. So here you can see next is the posterior interventricular artery, this one. Okay. Now the posterior interventricular artery, it arises from the right coronary artery just near the crux of the heart. As you can see, this is the crux of the heart. From here the posterior interventricular artery arises. Now once it arises, it passes to the posterior interventricular groove. The artery and the groove names are same. After arising, it descends into the posterior interventricular groove. As you can see, it is descending in the posterior interventricular groove. And near the apex, it terminates by anastomosing with the anterior interventricular artery. Okay, and this anterior interventricular artery is a branch of left coronary artery. Okay. So as I have mentioned, 70 to 80% of the cases, this posterior interventricular artery arises from right coronary artery. Okay, ये वाला जो artery है, this one. This artery, in 70 to 80% of the cases, it arises from the right coronary artery. That's why it is called as right dominance. If it is arising from the left coronary artery, then it is called as left dominance. Okay. Now, posterior interventricular artery gives few branches which supplies the diaphragmatic surface. You can see it is giving few branches which supplies the diaphragmatic surface of both the ventricles. Okay. Next, from the posterior interventricular artery, one very important branch is coming out, and that is called as septal rami or septal branch. Okay, which supplies the posterior inferior 1/3 of the ventricular septum. Okay, here you can see this is the posterior interventricular branch. From here you can see one branch. Now, why these dotted lines are given? Because those are in the posterior aspect. That's why dotted lines are given. Okay. So from here you can see one branch is arising, and here also from the left anterior descending one branch is arising. Those are called as septal rami. Okay, or septal branches. Now, what is the meaning of septal rami or septal branches? This supplies the interventricular septum. Okay, interventricular septum is very thick. Especially in the lower part, it is thick muscular. Okay, so it needs additional blood supply. For that, two dedicated branches are given, which are coming from the right as well as left coronary artery. Okay, so from the right coronary artery, from the posterior interventricular branch, one septal rami is going, which is supplying the posterior inferior 1/3, okay, of the interventricular septum. So this is the septal rami. Next, right posterior atrial rami are also there. In this diagram you can see right posterior atrial rami are also there. Okay, which supply the both right and the left atria. Okay, so these are the branches and area of supply for the right coronary artery. Okay. Next is the area of distribution for the right coronary artery. Okay. So what till now what we have studied? We have seen that origin, then course of the right coronary artery, termination of the right coronary artery, and branches. How we have studied the branches? We have divided it into atrial rami and ventricular rami. Okay. And then we have seen where it is supplied. Now, if we constitute all those things together, okay, then we will be getting this one. This area of distribution for right coronary artery, and it is different from the left coronary artery. Okay. Now, if anyone asks you what are the areas of the heart supplied by right coronary artery, and if you say only right atrium, right ventricle, no, you are wrong. Okay, it is specific, and you have to mention. So, for example, you can see entire right atrium is supplied by right coronary artery. Now, in case of right ventricle, some exceptions are there. Okay. Now, in case of right ventricle, greater part of the right ventricle is supplied, means most of the right ventricle is supplied by right coronary artery, except the area adjoining the anterior interventricular groove on the sternocostal surface. That is not supplied by the right coronary artery. Okay. Next, a small part of the left ventricle adjoining the posterior interventricular groove. So, this is the small part of the left ventricle that also near the posterior interventricular groove that is supplied by the right coronary artery. Okay. Next, a posterior part of the interventricular septum. Okay. posterior 1/3 of the interventricular septum, that is supplied by right coronary artery, and whole of the conducting system of the heart except the left branch of the AV bundle, that is supplied by right coronary artery. Okay, so these are the points specifically you have to mention about the area of supply. Okay, see, repeatedly I am telling you guys, right coronary artery doesn't mean that it will supply all the right atrium, right ventricle. ऐसा नहीं होता है. ठीक है. So that is all about the right coronary artery. Next is the left coronary artery. Okay. Now there are exactly the way we have studied the right coronary artery, we have to study the left one also. But the course of the left coronary artery is quite interesting. It is not same like the like the right coronary artery. Now what is the difference? First of all, if you see the left coronary artery, it is larger and it is carrying more amount of blood as compared to the right coronary artery. Okay. Now from where it arises? It arises from the left aortic sinus. As you can see, it arises from the left aortic sinus of the ascending aorta. Okay, mainly between the pulmonary trunk and the left auricle. So previously we have seen pulmonary trunk and right auricle. Here pulmonary trunk and left auricle. Okay. Now the trunk of the artery, after that it passes behind the pulmonary trunk and then appears forward and to the left between the trunk and the left auricle. Okay. Once it comes between the trunk and the left auricle, soon it divides into two terminal branches. What are these two terminal branches? Anterior interventricular branch and circumflex branch. Okay. Anterior interventricular branch is also called as LAD, left anterior descending. Anyone, have you seen coronary angiography report? Don't worry, I will show you some angiographic images today. So in clinical terminology, when clinically those arteries are used at that time, the names are different. So here in the book it is written as anterior interventricular branch. Okay, but clinically you will see that whenever the cardiologists they are mentioning, they will mention it as LAD, left anterior descending branch. Okay, then this circumflex they used to call it as LCX. Okay, left circumflex, LCX. So these are some terminologies used for these arteries. Okay, as we will go further, I will mention the important terminologies. This you have to use because second years you will be going for posting. Okay, in posting you might got the chance to see some reports, prescription and all. ठीक है, तो उसमें ये नहीं लिखा रहेगा anterior interventricular. They don't have time to write all those things. Simply they will write LAD. Okay. Blockage in LAD 30%, 40%, 70%. You can understand from that. Okay. So always correlate and use the clinical terminologies which are used. Or else again you have to study all those things. Okay. So this is the story for the left coronary artery. Okay. Now we have to study, we have to see the course termination, particularly for these two branches, that is the anterior interventricular and circumflex. Okay. Now among them the larger one is the anterior interventricular artery, which is the direct continuation of the left coronary artery. Okay. Now again I will use that easy diagram to explain the course. Okay. So here you can see, so this is the left coronary artery. From left aortic sinus it is arising. This is the left auricle and this is the pulmonary trunk. Okay, as you can see, after arising it is going forward and then towards the left. Once it comes on the surface of the heart, then it divides into two branches. Okay, as you can see, these two branches, this is the main stem of the left coronary artery, and then see it is dividing into two terminal branches. Okay. Now once it is going downwards, that's why it is also called as LAD, left anterior descending. Why anterior? Because it is on the sternocostal surface. That's why it is called as left anterior descending. नीचे जा रहा है. ठीक है. And circumflex means it is winding around the left border. You can see it is winding around the left border and then going posteriorly. That's why it is called as circumflex. ठीक है. So now we have to study about the anterior interventricular branch and circumflex branch. ठीक है, तो anterior interventricular branch, as I have mentioned, this is the continuation of the left coronary artery. Now it descends into the corresponding groove, that is the anterior interventricular groove in the sternocostal surface, and then it reaches up to the apex of the heart. ठीक है, once it reaches into the apex of the heart, near the apex of the heart, then it winds around the apex of the heart, and you can see it is going on the diaphragmatic surface of the heart. Can you see in the diagram? ये देखो, ये ऐसे करके आ रहा है. Okay, now it is descending in the anterior interventricular groove. Okay, in which surface? Sternocostal surface. Then it reaches near the apex of the heart. Once it reaches near the apex of the heart, it winds around the apex and then goes into the diaphragmatic surface. ठीक है? Now the anastomosis, now once it goes into the diaphragmatic surface of the heart, it ends by anastomosing with the posterior interventricular branch, and that posterior interventricular branch is the branch of right coronary artery, which we have seen just now. ठीक है, तो ये देखो, ये ऐसे करके diaphragmatic surface में जा रहा है, and from the right coronary artery we are getting the posterior interventricular branch, and this is the anterior interventricular branch. They will anastomose and it terminates over here. Okay. Now for the better visualization, you can see this particular image. Okay, तो ये देखो anterior interventricular artery आ रहा है, and this is the posterior interventricular, and here the anastomosis is taking place. Okay, now if you see the anastomosis, it is taking place at the lower aspect of the posterior interventricular groove. ठीक है, so this is the posterior interventricular groove. So at the lower part of the posterior interventricular groove, the anastomosis is taking place. Okay, and this is the termination of anterior interventricular artery. Okay, so once the termination is done, what is the next point after termination? So we have seen the origin, we have seen the course, then we have seen the termination. इसके बाद what is the next point? Branches. How to study the branches? Atrial rami and ventricular rami, or also called as atrial branches and ventricular branches. So see, now you are getting the points. Exactly you have to write in the exam. ठीक है? Don't mix everything together. Be specific. Now anterior ventricular rami on the both side of the left ventricle passes obliquely downwards. Okay. Anterior ventricular rami are there. You can see anterior ventricular rami. Okay. So for both the side. That means from the right side also and for the left side also. ये देखो, this is the anterior interventricular artery. Okay. So anterior ventricular rami are there for both the side, right side and left side. Now if you see the left side, okay, they are more prominent as compared to the right branches. Okay, and usually they are 3 to 4 in numbers. Next, now sometimes one of the left ventricular rami is large, and that is called as diagonal artery, as you can see. So these are the anterior ventricular rami. Okay, these are the anterior ventricular rami. This is for the left side, these are for the right side. Now the left side branches are more prominent, and among them one branch is very prominent and large, and this is called as diagonal branch. Okay, now one of the right anterior ventricular rami, that is called as left conus artery. As you can see, this is the left conus artery, which is taking part in the anastomosis with the right conus artery to form the annulus of Vuissens. Okay, next septal branch is there, which passes deep. Okay, from here you can see the septal branch is there, which passes deep, and then what it will do, it will supply the interventricular septum. Which part of the interventricular septum? Now previously we have seen the posterior 1/3. Now here it supplies the anterosuperior 2/3. That means most of the interventricular septum is supplied by this septal rami, which is coming from the anterior interventricular branch. Okay. So that is all about the anterior interventricular artery. Next is the circumflex branch. Here you can see this is the circumflex branch. Okay. Circumflex branch first passes along the left part of the atrioventricular groove, then winds around the left border of the heart, and then reaches the diaphragmatic surface. Okay, Now where it goes into the posterior part of the atrioventricular groove. Now in this diagram you can see, okay, circumflex artery, it is coming into the posterior part of the atrioventricular groove where it anastomosis with the right coronary artery just left to the crux of the heart, and this is the termination of the left circumflex artery. Okay, circumflex branch are also called as LCX. Now this circumflex artery is also giving various branches. For example, atrial and ventricular rami. Okay, atrial as well as ventricular rami. As you can see, these are the atrial rami and these are the ventricular rami, which supplies the adjoining surfaces of the left atrium and left ventricle. Next, SA Nodal artery is also coming out from the circumflex artery, but only in 35% of the cases, very less. Okay. Next, left marginal artery, as you can see, one long artery is extending towards the apex, that is called as left marginal artery, that also comes from the circumflex branch. Okay. And posterior interventricular only in 10 to 20% of the cases. Okay. So these are the branches which are coming from the circumflex artery. Okay. Now, okay. Next is the interatrial anastomosis. Now, the anastomosis which is taking place in the walls of the heart, especially in the myocardium, different types of anastomosis are there. For example, interarterial anastomosis is there, arteriovenous anastomosis, arteriosinusoidal anastomosis, sinusoidal, sinoluminal anastomosis. Like this, different types of anastomosis are there. Okay. Now, among them, one of the important anastomosis which is taking place, that is the interarterial anastomosis. What is the meaning of interarterial? Anastomosis which is taking place between the arteries. Okay. Now mostly if you see the anastomosis, that 85% anastomosis takes place at pre-capillary level and 15% at the capillary level. This is the classification of interarterial anastomosis. Okay. Now the major sites where the anastomosis are taking place, as you can see in this diagram. So three major sites are there. First of all, pre-coronal ring, that is the Vuessen's. Already I have mentioned the Vuessen's anastomosis. Okay, that is the pre-conal ring. Then retroconal ring, as you can see, this is the retroconal ring, and then retro-aortic ring, or also called as Kugel artery or Kugel interarterial ring. So these are certain areas where interarterial anastomosis is taking place. Okay. Now, which is very important. Okay, anastomosis must take place. Though anastomosis are taking place, that's why they are not called as end arteries. Functionally, they are end artery, but actually they are not end arteries. Okay. Next, the area of supply. Area of supply for the left coronary artery. So first of all, entire left atrium is supplied by left coronary artery. Then the left ventricle except the adjoining posterior interventricular groove. Okay. Next, right ventricle, which the area adjacent to the anterior interventricular groove or sulcus, that is also supplied by the left coronary artery. Okay. Next, SA node in 35% of the cases, and part of left branch of bundle of His. Okay. That is also supplied by left coronary artery. So see, the previous cases I have shown you the area of supply for right coronary artery. Now this is the area of supply for left coronary artery. Okay. So this is the way how to write about the area of distribution for both the arteries. Okay. Next is the cardiac dominance. So already I have mentioned what is the cardiac dominance, how it is determined. It is determined by the cardiac dominance is determined by the posterior interventricular artery. Now this posterior interventricular artery, clinically it is also termed as PDA, posterior descending artery. Okay. So these are the terminologies which you must know. Because see, why I am telling, in some I have seen in question paper sometime instead of posterior interventricular they will write PDA. Okay, you will get confused. What is PDA? We have never heard about this, but actually it is nothing but the posterior interventricular branch. Okay. So that's why every time the clinical terminologies must be known by the students. So in 80 to 85% of the cases it is right dominant, where PDA is the branch of right coronary artery, and only 15 to 20% is equally divided. Okay. Among them, some comes from the left coronary artery and some comes from codominant, that means from both the arteries. Okay. Next, at the applied anatomy. Now this part is also important, okay, because various questions are asked from the applied aspects also. So in the applied aspect, first is the coronary artery disease. Now what is this coronary artery disease? Now it is the heart disease caused by inadequate blood supply to the cardiac muscle due to the occlusion of the coronary arteries. So I have shown you various branches of the coronary artery. Okay? So among them, if any of the branches getting occluded or partially blocked or completely blocked, at that time the cardiac muscle will not get sufficient blood supply. Okay, which is called as coronary artery disease. Now the coronary occlusion, okay, it may be partial or it may be complete. The coronary occlusion, it may be complete or partial. Okay, and one of the major reason or one of the major cause of the occlusion is atherosclerosis. I hope you have heard about it, atherosclerosis. Okay, let me show you one diagram. Here you can see the diagram. Now coronary occlusion, as I have mentioned, one of the major cause is the atherosclerosis, that is the deposition of the lipids or cholesterol into the wall of the coronary arteries. Okay. Now due to the course of this accumulation of the lipid, what happens? Fibrostic changes are taking place. Okay. And as a result, plaque formation takes place, and that is called as atherosclerotic plaque. As you can see, small amount of fatty streak is deposited, okay, then fibrous plaque is formed, and then complicated plaque which is almost covering the lumen of the blood vessel. Okay, this is the coronary occlusion. Now development of the atherosclerotic plaque is common in the coronary arteries which are near the aorta, okay, जहाँ से starting हो रहा है. Now there are some important terminologies which you must know, that is the plaque will activate the platelets, and as a result a process initiates, and that is called as thrombosis. The plaque, what it will do, it will activate the platelets in that particular area. ठीक है, तो ये यहाँ पे plaque form हो रहा है ना, blood is flowing, so the blood, it will activate the platelets which are present over here, and as a result what will happen, the thrombosis will start. And once the thrombosis starts, after that what will happen? Thrombus formation or the clot formation will take place. Okay? Now when 3/4 of the lumen of the coronary artery, 3/4 of the lumen of the coronary artery is blocked, okay, the myocardium will not get enough blood supply, and that is called as ischemia of the myocardium. That condition is called as ischemia of the myocardium. Now smaller blood vessels are occluded by thrombus or the part of atherosclerotic plaque, okay, which is detached from the coronary artery, and those detached part is called as embolus. Now here you can see, तो क्या होता है? Once the platelet used to get activated, at that time in that particular area, okay, where the plaque formation is there, so what will happen? A process, complex process will start, that is called as thrombosis. After the thrombosis process initiated, at that time what will happen? A clot will be formed in that particular area, and the process of formation of clot is called as thrombosis. And when the clot is formed, and this is called as thrombus, you can see. Okay? Now sometimes what happens, from this large thrombus a small part will get dislodged and it will travel into the blood vessel. Once it reaches the smaller blood vessel, this particular clot will go and block the smaller blood vessel. Okay? Now this dislodged part is called as embolus. Okay, this dislodged part is called as embolus. So it will go and it will block the smaller blood vessel. Okay. So I hope it is clear what is embolus and what is thrombosis. Okay. Next, myocardial ischemia. It is a reaction of the myocardium in response to hypoxia. Okay. Why hypoxia is taking place? Because of the loss of blood supply. Okay. Now in that case what happens, hypoxia develops when the flow of the blood to the myocardium decreases severely, especially in the case of occlusion of the coronary artery. Okay. Now it is, now after that what happens, the collateral circulations are there, so those collateral circulation will open, and the part which is not getting blood supply because of the collateral circulation, in some cases it will go and supply the affected areas, in some cases, not in all cases. Okay. Next is the MI, or also called as myocardial infarction. Everyone, you have heard about this myocardial infarction. So it is a sudden occlusion of a branch of coronary artery lead to complete loss of blood supply to a specific area of the heart. That is called as myocardial infarction. Now when the myocardial infarction takes place, okay, there is reduced blood supply, and finally the necrosis of the tissue takes place. So जिस area में blood supply नहीं जा रहा है, okay, the necrosis of that particular area takes place. Okay. Now the part of the heart suffering from MI stops functioning, and that is the cause of the death. Now the conditions of the myocardial infarctions, the symptoms, angina pectoris is there, which lasts for more than 30 minutes, nausea, vomiting, tachycardia, shortness of breath, sweating, etc. These are the common symptoms of MI. Next parts. Now the pain which starts beneath the sternum and radiates. Now this is a referred pain symptom. Okay. Now what happens when MI is there? The pain starts beneath the sternum, and then it will radiate to the surface of the left arm and left shoulder, and sometimes it is referred to in the jaw or in the neck. Okay. So that is the referred pain of myocardial infarction. Okay. Next, the most important part, that is the sites of coronary artery occlusion. So many times I have mentioned that coronary artery used to get occluded. Now which part is getting more occluded? Okay. So as you can see, the statistics shown that anterior interventricular artery, or also called as left anterior descending, or also called as LAD. Now this branch is most commonly affected. Okay. Approximately 40 to 50%. Right coronary artery, next is the right coronary artery, 30 to 40%, and then circumflex branch 15 to 20%. Okay. So anterior interventricular branch, if it affects, then what will happen? Because as I have mentioned in the beginning, it is the continuation of the left coronary artery, and most of the blood is supplied to the myocardium of the left ventricle by the left coronary artery only. So if the left anterior descending is affected, it is more harmful. Okay. Next, angina pectoris. Now what is this angina pectoris? It is the chest pain originating from the heart due to transient myocardial ischemia. So what is myocardial ischemia? We have seen. Now sudden chest pain, if it occurs due to myocardial ischemia, then it is called as angina pectoris. Now clinically, if you see angina pectoris, there is constricting or pressure like pain will be felt to the patient deep to the sternum, and described as tightness, heaviness in the chest, and usually it lasts from 15 seconds to 15 minutes in moderate to high intense pain. Okay. Now it occurs due to incomplete or spasmodic obstruction of the coronary arteries. Okay. Maybe obstruction or complete or partial, or spasm of the coronary arteries. Okay. Now the pain classically felt in the precordial region and may be referred to the left shoulder and medial aspect of the left arm. So these are the areas where the referred pain will be felt, and this is clearly coinciding with the nerve supply of the heart. Okay, why the referred pain is felt. Next is the coronary bypass surgery, but before going to the coronary bypass surgery, I want to show you the coronary angiography. Okay, now what is this coronary angiography? Coronary angiography is a radiological procedure in which the contrast media is injected into the blood vessel, okay, to see the patency of the blood vessel. Okay, generally whenever X-rays are done, blood vessel cannot be seen. In order to see those blood vessel, a radiopaque contrast media is injected, and after that the scan is done in order to see the blood vessels. Okay. Now once the contrast media is flowing through the blood vessel, it will become opacified. That means brighter appearance will be there, so that you can see the blood vessel. Okay. Now if you see the image over here, so this is a artery where only 10% blockage is there. Here you can see 10 to 15% blockage. Here you can see 50 to 70% blockage, and here you can see more than 70% blockage is there. Okay. Now how to determine this blockage? Right now you don't have to know. You will see how much artery is getting brighter. Okay, because contrast is flowing. तो ये देखो, ये artery, this is more bright, and if you compare this one, this is more bright as compared to this one. इसका मतलब क्या है? यहाँ से ज़्यादा contrast flow हो रहा है along with the blood. यहाँ से less contrast flow हो रहा है, और यहाँ पे देखो almost stopped. So this is how the calculation is done. Okay, some other classifications are also there, but you don't have to know all those things. Just to show you, okay. Another image is there, see, plaque formation. This is how the plaque formation appears in coronary images. ठीक है, तो देखो यहाँ से blood flow almost stopped, and then again the blood is over here. That's why you can see the contrast is present. So this is the way to determine in which particular segment of the artery the block is present. Okay, अब artery में blockage हुआ है. Now how to determine which part of the artery is blocked? Okay, so with the help of the angiography, जहाँ पे block part होगा, you will see that part is not highlighted because blood flow नहीं हो रहा है ठीक से. So contrast will also not flow. So that part will not get highlighted. Other parts will get highlighted. So this is the easiest way to determine. Other techniques are also there. Those are more complicated. So I'll use simple term to make you understand. Okay? So these are some important clinical aspects, okay, of the coronary arteries. Now other things are left. For example, coronary bypass surgery, okay, then angioplasty. So I'll request you guys to study because these things are not that difficult. If you study, you will understand. So today we have discussed some important topics. For example, what are coronary arteries, okay, from where they are arising, course, termination, branches, area of supply, peculiarities of the coronary arteries, okay, followed by the MI, and then angina pectoris, okay, clinical importance, and the referred pain also. Okay. Now only one part is left in the coronary circulation, actually not in the coronary circulation, in the blood supply of the heart, that is the venous drainage. That part is left. So if I get time, it will be discussed, or else you can study from your own. It's not that difficult. Okay. So you have to know the veins of the heart, where they are draining, where they are present, okay, and after draining, where they are going, in which chamber they are draining. Okay. So that's all about the coronary circulation. Thank you.